and work out, of course you want to put good foods into your body to help your body rebuild. Because when you work out, you're not gaining at the gym, you're gaining when you're recovering. And so a good rule of thumb we teach our patients is try to eat what you did when you lived on the farm in the 1800s. What did you find? You found meats, dairy, vegetables, fruits, and good clean water. So that's a good staple diet.
In terms of the marketing out there, it seems like there's some kind of drink or some kind of pill or something for everything after you work out to recover. Are there things that you need to take, or is this basically for the person who is an athlete or trying to build big mass?
There are products specifically made for athletes. For most people that just go to the gym and work out, just drink water. It's got everything you need to replenish the hydration of the body. You don't need the sugary drinks. Stay away from those. But when we do nutrition response testing with patients, we're actually looking individually at that patient. Everybody's different. So when you come in, your body has different needs than my body. So we actually test the body's neurological reflexes to see exactly what does Randy Gardner need versus what does Rob Elder need. And we can test the products against that patient's neurological system and see if it's right for them or not.
All right, let's talk a little bit about that testing. How is that done? Is it an invasive testing or?
Not at all. No, we don't cut you open.
I'm worried. Well, I'm like, okay, let's figure out how we do this.
It's basically through muscle testing. We actually test a patient's muscle response using the deltoid muscle. So I'm actually just putting pressure on the arm and getting a reflex. It's basically testing a neurological reflex. So the body actually communicates through this neurological reflex, and we can actually identify what product or products are best for that patient, depending on what they're dealing with, and then how much they actually have to take. I love the specificity because if a patient comes in and I find a product that's going to help them that they test well for, we get as specific as how many to take. The body will tell us if it wants 4 or 2 or 6. So instead of saying, take 2 and call me in the morning, I know you need to take 4 and that patient knows they need to take 4.
Are you amazed by how people will spend so much money on their hair, their teeth, their makeup, their clothes, and then neglect their body?
Absolutely. Yeah, because it's... once again, we forget about how our body functions and what the purpose of our body is if we don't feel bad. And so people, boy, as soon as their car light comes on, engine light comes, get it to the mechanic right away. But as soon as they start feeling a symptom in their body, oh, it'll just go away. I'll just take some Advil, or I'll just ignore the pain or whatever, and then we get a serious health issue. And I've got kids in my practice that are, they're having some real serious health issues. And fortunately, the mother or father is a patient, and they've been through that route where they neglected it. And it takes a long time to get that health back. So as soon as our kids get a problem, let's go see Dr. Elder, let's get this checked now before it gets a real problem.
Just want to let you know my check engine light's been on for 90,000 miles in my car.
Yes.
So that shows you how...
There's some things I can't fix.
You can't correlate. As you talk about eating right and being healthy, how soon do you start? I've got a 4-year-old and I've got a 12-week-old baby. Mm-hmm. When do you start with trying to get the nutrition set in them? I mean, is it okay to splurge as a young? I mean, everybody's got to go to the fast food place to get that meal every once in a while. Is it okay to do that once every couple of weeks?
I mean, we live in a society where that's going to happen. I don't try to get people to eat perfectly, but just have a sensible, reasonable diet. But I've got a 22-month-old, I've got an 8-year-old, and a 12-year-old. And it's funny because my 12-year-old thought it was like punishment to eat organic. My parents make me eat organic, and now it's just another thing. But all my kids eat organic. My little baby girl had an organic egg and steel-cut oats with unsulfured organic molasses on it. So that's her breakfast, and she eats it up and loves it. So you can never start too early.
In terms of buying something like this, without naming any specific markets, do you go to a certain place that has all organic food?
Most stores carry it.
I go to, I don't think.
Well, most stores do now. I think even the big chains are really seeing the demand for it, so they are expanding. As if you go to a certain store, you'll see that they have organic aisles. It used to be 1, now it's 4. But there are specific stores and chains that are simply organic. That probably people have heard about. So you check those out, and that's usually where I refer my patients to.
I'll have to check a little more between the pretzel aisle and the soda aisle to see if that organic aisle is right down the middle.
And that's a great, and you bring up a great point. When you shop at a commercial store that isn't an organic store, shop the perimeter of the store. So all your vegetables, your fruits, your dairy, all the good stuff is on the outside of the aisle because they have to be refrigerated. All the garbage is in the middle. So that's where you shop.
Let me write that down real quick.
Perimeter of the store. So.
Do you find that, and my wife says this, being in the medical field, that 90% of what you do, the patient has to take to heart what you tell them to do and be responsive to it, or it's not going to work. You can tell them till they're blue in the face, but unless they believe in it and they take it home and they practice it, they're not going to get better.
Right. Yeah, there's got to be patient compliance. We actually have patients sign an agreement with us that gives me permission to release that patient if they're not being compliant, because I want patients to do well. And my joke is I've got 10 minutes in here with you, and you have 23 hours and 50 minutes to screw it all up when you're gone. So I can't hold your hand. I'm there for you. You got questions, call me. And but yeah, once they walk out the door, they've got to take ownership. And so we teach patients. We have classes to where we teach them about what are foods. We teach them about chiropractic. How does your body work, so they can get good knowledge. But they've got to take responsibility.
We've talked a lot about nutrition, but as far as your back and your health, it seems like your back is one of the things that can affect everything else. It keeps, if you hurt it, well, you don't get out and do the exercise. You're always worried about it. Since I hurt my back that time, everything I do, I'm worried about, should I lift this? Should I not? And I never thought like that before.
Right, right. Yeah, once you injure your back, it comes to your consciousness level once again. And so it is good to protect it, and it forces you to lift correctly and to not overdo your limits. So, I have a herniated disc in my back as well, but I function great. I go to the gym, I work out. I shoveled about a ton of dirt on Sunday, but I was comfortable with it. I did my limits. I didn't do too much, and I functioned just fine.
In terms of once you hurt it, can you ever get it back to the way it was before, or are you just kind of under the estimation of I've got to hurt back at some level?
We can get a patient to where they are 90-95% recovered, and that's long term. But once again, we have to address health from different aspects. I can adjust a patient all day long, but if they're not doing their exercises at home like they should be, we're missing a piece of the puzzle. If they're not eating well, they're not replacing the body with the genuine replacement parts they need to heal that back, so we're missing a piece of the puzzle. So if I've got a compliant patient that's going to do their exercises, going to get their adjustment, going to work on the core exercises, that's a patient's going to really do well.
Now, I know you don't like the word cracked, but I know a lot of people, that's what they call it. I'm
it's
going to get my back cracked.
Yeah, that's the noise. Yeah.
The adjustment on your back. What exactly are you doing? Because it just sounds like it's a painful thing.
Right. Now, the adjustment itself is, we are basically, what I do with spinal correction is we are taking the spine from one position, the bad position, and putting it into a mirror image position and adjusting the spine, which means basically stimulating receptors to create a new normal in the brain. And we also increase the motion, because when a spine gets dysfunctional, it loses its normal motion. And so when we adjust that spine, and it's a very easy move, it just creates a little motion. And when you create motion in the spine, the pain will decrease, the function increases, and that's how it works. But that noise you hear, that crack, it's like popping your knuckles. It's carbon dioxide and nitrogen gas.
So a lot of people are thinking, who have never been to a chiropractor, is this a painful thing, and can anything go wrong when you crack my back, like it snap in half or something?
Right, yes. I've never snapped anybody in half. Well, and that's why you do want to go to somebody that's trained in it. Don't go to I've heard of all sorts of different people. Yeah, I went to my barber and he cracked my, oh my gosh, so go to a trained professional, obviously. Some people don't like the manual adjusting. So we have instruments that we use. We do instrument adjusting to where the patient really doesn't feel much, and there's no snap, crackle, pop. You can never start too early. My baby girl climbs on my table, loves to get adjusted. But are there things that can go wrong? Yes, but that's why we do exams. We never adjust a patient until we've done a thorough exam, done any necessary x-rays to diagnose the problem, and then find out the best treatment regimen to get that patient well.
In terms of someone wanting or needing to know if they need to go to a chiropractor, where do you get to the point, besides if you're going to go all the time, like you had mentioned, as a as like
for chronic illness
exactly.
or back issues.
When do you say, okay, my back's hurt bad enough, or you stand in the mirror and you're slanted like this, or when do you know?
We try to teach patients to do a self-check. So like the dentists use with the little tablets that you used to chew in school, and you get the pink, and you have to brush it off, that means you got plaque. Well, the chiropractor's plaque, if you will, is posture alterations. So if you stand and look in a mirror, and if you see your shoulders are not level, if your shoulders are tilted, if your head's tilted.